Hello, everyone. I am Allison Footman, and I lead the STI program at AVAC. I'm excited that today we have joined with the American Sexual Health Association, ALSHA, in hosting this webinar, Protecting Your Health, the Importance of STI and HIV Testing in the Modern Era. We will include links in the chat so that you can learn more about the work that ASHA and AVAC are doing. But today we will hear from three incredible speakers, including Dr. Chase Cannon, Shauna Dell, and Jalen Daniels. To learn more about our speakers, I will post their bios in the chat. Chase and Shauna will be discussing everything you need to know about STI and HIV testing, especially when taking or considering PrEP. We will then move to Jalen, who will discuss community perspectives and needs for STI and HIV testing. And we will end this session with a Q&A session, so please be sure to put any questions in the Q&A box or the chat. And finally, I want to say a special thank you to our sponsor, Roche, for their help in planning this webinar today. And with this, I will hand things over to Chase to begin their presentation.
Great, thank you very much, Allison. Hello, everybody, and welcome. As Allison said, my name is Chase Cannon. I am based in Seattle, where I see people who are living with HIV and also who are at risk for HIV and STIs. So I'm going to talk to you today about testing for both of those things and specifically what you need to know. We'll start with some of the basics, and then we are happy to take questions that you might have about things that might be a little more advanced. So just to start, so everybody's on the same page, what is HIV? Because I sometimes hear that people don't actually know what that stands for. So it stands for Human Immunodeficiency Virus. So that's an acronym. And HIV is a virus that causes a lifelong or chronic infection in humans. And if it's left untreated, it can lead to damage to the immune system. It's transmitted through sex. It can be through injection drug use. Or if someone is pregnant, it can be transmitted from mother to the baby during pregnancy or labor. We do have some strategies to prevent HIV that work very well, things like PrEP, which stands for pre-exposure prophylaxis. You'll hear more about that from Shauna later. And if one does acquire HIV or they're living with HIV, it is something that is treatable with medications that are antivirals. So for most people, that is just one pill a day. Some people, it's a couple of pills a day. And now we actually have injections as well that people can take so that they don't need to use pills. But people can live a healthy life with HIV. However, we don't have a cure or a vaccine yet. There are a lot of really smart scientists and community members who are advocating for this and working on it, but it's something that we have not achieved as of yet, but we hope for that in the future. So what are STIs? So that's, again, another acronym that stands for sexually transmitted infections. And so these are infections with either bacteria or viruses or sometimes even parasites that affect humans and may or may not actually cause any symptoms. So like HIV, STIs are transmitted through sex and can be passed in some instances to a fetus or a baby during pregnancy or labor. The top three most common STIs that we sort of talk about in our work and in community are all caused by bacteria that you see here on the bottom. So gonorrhea, chlamydia, and then syphilis. Each of these, again, we can prevent with strategies like condom use or doxypep, which you'll hear a little bit more about later, which stands for doxycycline post-exposure prophylaxis. And then if someone gets an STI, it can be news that is hard to take. But the good news is that all of these things can be cured by antibiotics, each of these STIs. So if you get a pill or an injection, it will take care of the infection and you'll be cured, and there should not be any sort of longer lasting complications. But it is important to know if you have an STI so that you can get treated. So why is it important to get tested? So I'm going to talk first about HIV and then I'll talk second about STIs. So specifically with HIV, as we talked about, this is a lifelong infection. And so if someone is not treated for their HIV, it can attack the immune system and make their immune system weak so that they have trouble fighting common infections. So things like colds or pneumonia are more common if people have a weak immune system due to advanced HIV. You may have heard the term AIDS, which is a syndrome that happens when people have very advanced HIV that is not treated. And in those cases, it can cause severe illness or sometimes even death in people. So that is why it's important for you to know your status early. So getting tested so that you can get started on treatment helps you protect yourself and your own health, as well as sex partners, and in some cases, babies. So if someone is pregnant, HIV can be passed during pregnancy. And so getting on treatment is the best way to prevent that from happening. And then if someone finds out that they are HIV negative, so their testing does not indicate that they have HIV, they can start on PrEP. And that is also important to continue to prevent HIV in the future. Now let's move to STIs. So why is it important to get tested for those? Because again, not all STIs do cause symptoms. So sometimes you might have symptoms that make you want to go test and find out what's going on, but you may not always know that you have an STI. Some of them, like syphilis, can actually cause pretty serious health problems if they're not treated early. And so it's important to know as soon as you can if you have an STI, again, to protect yourself and your health, your sex partners, and also baby, prevent possible complications. So in the case of syphilis, it can cause hearing problems, eye problems, if it's not treated soon. So the sooner that you know, you can get treated and cured. So let's talk about some testing terminology. There are two different terms that you might hear when we talk about getting tested for HIV or STIs. One of them is screening. So this is when you go in for just a routine checkup. You do not have symptoms, and that term you might hear someone say is called asymptomatic when you have no symptoms. So that's often what we recommend. People get screened if they are living with HIV. They will go in and get screened for STIs. People who are taking HIV PrEP will go in and get checked. People who are pregnant, or then if you have an exposure to either HIV or STIs, you're recommended to be screened. We contrast that a little bit with something called testing, which is also known as diagnostic testing. So this is when you are getting tested for HIV or STIs when you do have symptoms. And so that could be something like fever, sore throat, or joint aches, which might be a sign of early HIV. Or if you've got a rash on the body or genitals, burning with urination, or a discharge, or abdominal pain, those could be signs that you might want to go get tested for HIV or STIs. So first, let's talk about who should be tested for HIV. So in the United States, we know that in 2022, for young people aged 13 to 24, just over half of them knew their status. So that means there's still a lot of people out there who don't know their status. And getting tested is really something that you do for self-care. It's how you take care of yourself and your health. And so again, knowing your status is important so that you can take actions to live your best life and have a full and pleasurable sex life and live a long time. So CDC does recommend anyone who is age 13 to 64 get an HIV test at least once as part of routine care. And then there are certain people who we recommend get tested more frequently, especially if you're having sex often and you're not taking PrEP. That is a reason that you would want to get tested more frequently. So who should be tested for STIs? Really, this is a lot more simple. So basically, any person who has ever or is currently having sex. There are some people who are at a little bit higher risk for exposure who might want to test more regularly. Those include adolescents and young people, people who are pregnant, people from minoritized racial or ethnic groups, men who have sex with men, and then transgender women. And again, this is important because especially for young people ages 15 to 24, CDC has found that nearly half of people who are diagnosed with STI in this country are in that group of young people. And so they may or may not even know that they have one. So it's important for them to get tested for that reason so they can get cured. So what are the types of HIV tests that we have? There's lots of different categories of them. Here's a graphic that kind of shows you um, when the test might be able to capture infection. So the best test we have is called a nucleic acid test. You might also hear a viral load as the name. That can detect HIV the soonest. And then there are some lab-based tests that can detect HIV anywhere from 20 to 40 days. Then we have rapid tests that you might get in a clinic where they prick your finger and take a blood sample. Those are anywhere from 20 to about 90 days. And then there are ones you can buy over the counter that have a little bit of a longer window period. So all of these tests are available to be done as a blood sample that you would get. And then the last one that you can buy over the counter, like in a pharmacy or order online, would be a mouth swab. So that's the easiest one, but that is the longest time period for it to be able to detect an infection. So if you want to know the soonest from a recent exposure, a blood test is best. For HIV, we talked about sort of how you can get tested there. STIs, it's a little bit different. It depends on the type. So for gonorrhea and chlamydia, you can get a swab just with like kind of a Q-tip of the genitals, the mouth, the throat, or rectum. And then for syphilis, it is most often a blood test that tests for either antibodies or parts of the bacteria in the body to let you know that syphilis is present. So where can you find HIV and STI testing? There's lots of different places. So I have several listed here. You might go to a sexual health or STD clinic where there are experts there who often can get you low cost testing. Your regular HIV provider, if you're living with HIV, or a regular primary care provider can do that. If they don't ask you about testing, you can always ask them to add that on. And sometimes it takes you educating them about what you need. Emergency rooms or urgent cares, you can go and get care there, but sometimes the wait times are pretty long. There are services where you can get testing online as well. It's pretty convenient and discreet, but you may have to pay out of pocket. CDC has a service where you can type in your zip code and find out testing locations near you. And then there are also pharmacies that provide some sexual health care, and that's a place where you can actually purchase home self-test kits for HIV and now for syphilis. So lots of options, a lot of information, but I think the top sort of line here that I want you to take away is that in order to keep yourself and your sex partners healthy, it is important that you get tested so that you can know your status. And we just had National HIV Testing Day in June, and so I wanted to show that because that was an important time. Thanks.
Thank you so much, Chase, for that really great and comprehensive presentation on some of the basics for HIV and STI testing, but also how someone knows when they should get a test. And my main takeaway message is that everyone should get tested. And if your healthcare provider isn't providing you with the option to get tested, ask them for it. But now we are going to switch over to Shauna Dow. So Shauna, thank you. And here you go.
Thank you. I'm just setting up my screen. All right. All right, I think you all can see the bright view.
Other way, Shauna, we see your
Other
presenter view.
way. All right, fine. All right,
Beautiful.
perfect. Thank you. Thanks so much for having me, and I'm super excited to talk to you all today. My name is Shauna Dell. I'm the Sexual Health Services Program Manager at Chase Brexton Healthcare in Baltimore, Maryland. And I'm going to talk to you today about STI testing and PrEP. So I first wanted to kind of outline some terms because a lot of people say STDs, some people say STIs, and just kind of really make sure you all know what they mean. STD is a sexually transmitted disease. The term disease means that there are symptoms present. So while all sexually transmitted diseases are STIs, not all STIs are diseases. As Dr. Cannon said earlier, a lot of STIs uh, are asymptomatic or don't have symptoms. And so that's why I'll generally be using the term STI today. And that's an infection that can be transmitted through sexual contact and may or may not have symptoms. And about between 60 to 90% of STIs actually have no symptoms, mainly gonorrhea and chlamydia. And this depends on the STI and the site of infection. So it's really important to get screened for things regularly if you are having sex, especially if you're having sex with multiple partners and without condoms or other barriers. So what is PrEP? There's PrEP and PEP, and people often get them confused. They're very similar. PrEP stands for pre-exposure prophylaxis, so that would be before sex. There's also post-exposure prophylaxis, which we're not going to talk about today, but that is something that is available. It's medications that you have to start within 72 hours of a possible HIV exposure, and you can get them. There are different places. Sexual health clinics will often offer PEP as well as emergency departments. So it's something to keep in mind as a tool in our toolbox of prevention. But pre-exposure prophylaxis, or PrEP, prevents HIV from attaching and incorporating into your cells. And it's really a way to control your own sexual health when it comes to HIV. And anybody can take PrEP. You can also go on and off PrEP as your current lifestyle dictates. Uh, there's no negative impacts that can happen if you need to go off and then restart it later, as long as you are protecting yourself from HIV while you're off of it. There are several different drugs at this point that we have for PrEP, including daily oral pills. These would be FTAF and FTDF, or Descovy and Truvada. Truvada also comes in a generic version, which has made it more affordable. There's cabotegravir, which is an injectable PrEP option that's generally every 2 months. And then there's lenacapavir. It was just approved for PrEP by the FDA like 3 weeks ago, late last month. So a lot of places aren't quite offering it yet, but we're getting there. um, there's also different types of PrEP in addition to the daily pill and the injectable. There is 211 PrEP. It's also called on-demand PrEP or event-based PrEP, or it has many other names. And this is a way to take PrEP uh, after before you take pills before sex and then after sex. And this is really good for people who have scheduled sex or have less sex than like less sex, so that they can be prepared and take it only when needed if they're going to be taking it like less than every day. It is not recommended if somebody's risk factor is injection drug use or vaginal sex. So it was only studied in men who have sex with men and has only been approved uh, for men who have sex with men generally. And PrEP does not protect against other STIs. So something really important to keep in mind. Who should be offered PrEP? It's not just for gay men. I know this is a very common misconception, and I know we see a lot of advertisements that really focus on that population, but anyone can be on PrEP. The CDC says that sexually active adults and adolescents who have had anal or vaginal sex in the last 6 months and have an HIV positive sexual partner, especially if they have an unknown or detectable viral load, have had a bacterial STI in the last 6 months, or have a history of inconsistent or no condom use with their sexual partners, should be offered PrEP. As well as people who inject drugs who have an HIV positive injecting partner or are sharing their injection equipment. Um, Also, a lot of clinical protocols include basically anyone who asks for PrEP. And there are also programs that can assist with the cost of medication. So that shouldn't be a barrier. Where can somebody get PrEP? A lot of primary care providers will offer it. A lot of primary care providers don't know about it or don't know a lot about it. Some, if you ask them for it, will look into it and then offer it. And some may say, I need you to go to a specialty care clinic. Infectious disease and HIV specialty clinics offer PrEP. Sexual health clinics or STI clinics also tend to at least do PrEP starts, if not do all of the continuity care as well. And then there are also a lot of online telehealth providers if that's easier route for you to take. So what's expected when somebody is on PrEP? You're expected to come in for regular follow-up visits, and this can be between every 2 to 6 months. So, like if you're getting cabotegravir, that injection, you start out with one injection, come back a month later for the second injection, and then after that, you're coming in every 2 months. With the new lenacapavir, that's an injection every 6 months, and then with oral PrEP right now, the guidelines say to come in every 3 months. It's also expected that you'll get regular lab work. So this includes STI testing, again, every 3 to 6 months, and that varies. And then also, you're going to want to get other routine lab work, and this looks at your kidney, liver functions, lipid levels, and anything else that the medications might interact with in your body. And then you'll also have to either take a daily pill, take 211, or come to clinic for a regular injection. PrEP really only works if you take it. So what's the link between HIV and STIs? Well, we know that having STIs having STIs can increase the risk of someone getting HIV. And the CDC data from 2018 said that estimated that about 6% of sexually acquired HIV infections could be attributed to chlamydia, gonorrhea, and syphilis. And it also costs a lot of money, generally speaking. Research has also shown a link between having an STI and getting more STIs. And we're not 100% sure why that is, but there's a lot of contributing factors. There's a lot of similar risk factors. So the same things that put you at risk for being exposed to chlamydia also puts you at risk for gonorrhea and HIV. There's also biological mechanisms, especially with the STIs that can cause sores and lesions or breakdown in the skin that can leave it open to getting other infections. So a lot of providers that I talk to still sometimes think that if they put their patients on PrEP, it might lead to more STIs. And this is a common misconception that I've also heard among other people. Um, we haven't we have seen some increases in STIs after PrEP initiation. However, people on PrEP test more frequently. Remember, you're coming back every 3 to 6 months. That tends to be more frequently than the general population. So it could just be picking up on more STIs because of that. There's also a lot more education and awareness about STIs when you're regularly being seen for sexual health. There's also a theory, it's called risk compensation. And in the case of PrEP, this would be a theory that people might change their sexual behaviors because they are doing something that is protecting them against HIV. And some studies have shown that behaviors do change after PrEP, and some studies have shown that behaviors do not change after PrEP. It's really actually hard to study this because there might be some self-selection, right? So if somebody is a good candidate for PrEP and goes on PrEP, they might already be having more behaviors that could potentially lead to encountering more STIs uh, versus somebody who has decided not to go on PrEP. And then also, there have been general population level changes in sexual behaviors and especially in condom use. So it's just a little difficult to assess. So does PrEP use lead to more STIs? Maybe, maybe not. I think the most important thing is that you're protected. And just to keep in mind that PrEP is part of a prevention toolbox. I tried to generate an image using Microsoft Copilot, and it gave me this lovely monstrosity. I don't think AI is coming for this job particularly soon. But the prevention toolbox, it includes PrEP. It also includes PEP, like we talked about. Dr. Cannon brought up DoxyPEP, which can protect against STIs, especially chlamydia and syphilis. There's also barrier methods, so dental dams, condoms, internal condoms are all great STI and HIV prevention. Lube can be great for prevention because it really decreases potential skin breakdown. Regular STI and HIV screening can be part of our prevention toolkit. U equals U, or undetectable equals untransmittable, and treatment as prevention is great for preventing HIV transmission. Talking to, not for, thank you, AI, talking to your partners is really important, especially having conversations about the last time people were tested and what the expectations are in terms of protection. Needle exchanges and making sure to use clean equipment is great. And there's so many more things in our prevention toolkit. So thank you so much. And I think we're moving on to the next person, and we'll have time for questions at the end.
Thank you so much, Shauna. I think your presentation really highlighted just how many options we truly have, both in PrEP, but also in prevention overall. So I really appreciate that presentation. Next, we will move to Jalen Daniels, who will provide us with more of a community perspective and some on the ground, I think, lessons and thoughts around this conversation. I would say to keep putting your questions in the Q&A and the webinar chat box, as we will get to them once Jalen is done. So I hand it over to you, Jalen. Thank you.
Thank you, Allison. Yeah, so my name is Jalen Daniels. I'm currently a nursing student. I'm here to just talk about like the community perspective, I guess I'd say. So the ways I talk about like STI testing with my friends is that, you know, I really try to frame it as, or friends and family too, I try to frame it as like more of a health equity issue as opposed to it being like a reflection of who they are. So just saying that, you know, like it's on you to protect your health, right? And to know about your health is to protect your health. I think that shockingly, like people in Gen Z who are a little bit younger are like more conservative than the older people. So like just framing it in like a health equity way makes it more equitable, for lack of better words. I also talk about doxypep with my friends, which is, you know, a way to prevent bacterial STI infections. And I basically tell them that it's a 3-2-1 method. So within 3 days, take 2 tablets or 200 milligrams of doxycycline just one time and no more than like 1 dose per day. And then when it comes to like PrEP, I talk about that very differently with like, not very differently, but with my friends, right? Like, because 1 in 2 Black men or 1 in 4 Latino men who have sex with men will potentially have an infection of HIV. And I think the way that I talk about it with them is a lot more serious. I don't know why. I think it's just more of like a thing where I feel like we have to show up for our community. And not to say that there's anything wrong with having HIV, because there's not, absolutely not. But just about protecting people's health, right? And the way that I talk about it then is that, you know, like you could take PrEP. There's multiple ways to start taking PrEP. You can take it 1 pill a day. There's injections for PrEP where you do 1 injection every 2 months, or you do PrEP 2-on-1, which is what Shauna was just saying, where you take 2 pills within 2 hours before 24 hours before having sex, and then 1 pill 24 hours after that, the first 2 pills, and then another 1 pill 24 hours after that. And that prevents the infection of HIV. So I talk about the ways that you can take PrEP. And I think that like sometimes it's kind of like in my head, like if you're not taking PrEP, it's kind of inevitable, unless you're using condoms, all these other things, but it's kind of inevitable. Sorry, this is not scientific at all. But in the way in my head is it's kind of inevitable that you will maybe be infected with HIV, and then you'd have to take retroviral drugs. So I think the thing is like there's no shame in taking PrEP, and there's no shame in taking antiretroviral drugs, because either way you're protecting your health, right? And I think what's important that like in the age of misinformation, if you could even ever still in that age, the age of misinformation, the age of censorship, like what's important is knowing the facts surrounding like your sexual health, the facts surrounding your health, and you know, having discussions about that, because unfortunately you can't really trust entities that were formerly trustworthy, I would say. So if your doctor like doesn't want to prescribe you a certain medication, you can find another doctor who will. You can use things online like Mister or Urgent Care or CVS Minute Clinic to try to get like the healthcare that you deserve. And yeah, I think that's all that I have to say. So thank you so much. That was really short, but try my best here.
Thank you, Jalen. That was really great. And so I invite all of our speakers to now come on video, including Shauna and Chase. And we will move into the Q&A session. And so I'll just start off first. We had a question come in about HSV 1 and 2, which is typically genital herpes, and how genital herpes is incredibly common, but not often talked about. And so I do just want to highlight this webinar specifically focused on HIV and STIs, including chlamydia, gonorrhea, and syphilis. There are many more STIs we could discuss today, including HSV 1 and 2, but we decided to limit our scope for today's webinar. Also, when thinking about genital herpes, I'll say that there are a lot of great conversations going on right now about herpes, herpes prevention, and herpes testing. And one of the things that makes herpes really difficult is that we don't have the best tests for detection. And so if you don't have the best test, sometimes those results can be really confusing. And the goal is that through these conversations and through raising awareness about STIs, we will one day get to a place where we have amazing HSV 1 and 2 tests so that we can have more productive conversations about what those test results mean. But that's just a little bit of why we're not talking about herpes today. And I am excited to move into some of the other questions that are in the Q&A box and in the chat. And so we had one question come in where they said a friend told them to get an HIV test since they haven't been tested in a long time. This person keeps telling their friends that they don't have anything going on, so they might not need a test, but their friend keeps pushing back. So, what is some advice that you guys would provide in a situation like this? When is it important to get tested? How do you know when to get tested? And maybe what are some of the reasons why you would and wouldn't choose to get tested in a situation like this? So I open that up to all of our great panelists today. Either any of you can go first.
Maybe I will start since I talked about HIV testing. So first, I think it's great to have friends who are reminding you, pushing you to really take care of your health and know your status to get tested. So I think that's a good thing. Any person who hasn't been tested in a long time, generally it's a good idea to get tested, but there are some people for whom it maybe doesn't make the most sense. So, for instance, if someone is not having sex, they haven't in 10 years, maybe it doesn't make sense to test them again if they were tested the last time that they had sex and were negative. So, you know, everything isn't exactly sort of a rule. It is individualized for the person. And so, what I would say is, if there's any question, you talk to your provider, whoever that is, primary care, someone in urgent care, um, whoever's offering your sexual health care, and ask about what's right for you. So say, hey, I was told maybe I should test, and I don't know exactly if I'm due or if I need to, and they can help you walk through it to know if that's what is appropriate for you.
The one thing that I might add to that is that if you're talking to a potential sexual partner and that's something that they need to feel comfortable, and you haven't gotten tested in a while, it might be a good idea to do it so that you can show that partner the results because they're also trying to be responsible for their health as well.
Yeah, and I think what Dr. Cannon said earlier about like if it makes sense not to get tested, then you probably don't need to, but also I think what's important to know is that like many STIs are asymptomatic. So you could have an STI and not an STD, but you would know that, I mean, you wouldn't know without getting tested. So sometimes it's important, like HPV or anything else.
And I'll say, for HIV and for STIs, there are so many ways for these infections to be spread. And so it's not always through, I think, like common sexual activities or even penetration. Like there are just so many ways for these infections to be spread. And even when you think that you're engaging in behavior where maybe you think, oh, I'm not going to get an STI from this, or I'm not going to get HIV from this. If you have questions, you should definitely talk to your healthcare provider and really figure out what's going on with your body and what you could potentially have or not have. But I do think, as Dr. Cannon started, kudos for even having these conversations with your friend. I think is so important for us to be able to talk to our friends and our family members about getting tested and the importance of that. And so thank you to our speakers for answering that question. We had a question in the chat about, are there any updated data? So this thought that a lot of data was from before COVID. And during COVID, they believe the data was maybe a little bit different. And so really thinking about both Chase and Shauna, I think you presented data. And so what are your thoughts on updated and current data?
Yeah, so during COVID, STI rates, we saw a little decline, probably due to people not going out and getting tested. We all know we were not necessarily doing in-person appointments with our providers during that time. And so there was like a decrease in STIs, but that has kind of come back after COVID, and there has been an increase in most of the STIs since that. One of the reason that some of the data presented is a little behind is because it does take a couple of years for the entities that make all of the do all the data reports to actually put that data together into something that's reportable.
And the other thing I would maybe add is one exciting thing that we've seen pretty recently is that nationally, the last report that CDC put out, it seems like for the first time in a really long time, we're seeing a little bit of a decrease in the numbers of syphilis infections and the rate in men who have sex with men specifically. And in some parts of the country where people are using doxypep more, we've seen that that's starting to have an impact on STIs, so both chlamydia and syphilis, which is exciting. So that's sort of new post-COVID data that we didn't necessarily dive into because that's a little deeper than just the general. But I'm glad that that question is asked because there are some important updates that we've seen just in the last like 2 years even.
And with this data question, sometimes there are always maybe a little bit of confusion. Why is this data important, especially when thinking about data among men who have sex with men or among different racial and gender identities? Why is that data important? Or is it important? You're both nodding yes, but neither one of you are saying anything. So
Yeah, I mean, as a program manager, it's really important to identify what areas need to be focused on and also where the health disparities are so that you can do some more targeted messaging and making sure that you are reaching out to those populations and making sure that services are meeting people where they're at and serving them the best. And you can't do that without a data-informed approach.
Yeah, I agree. I mean, the CDC is sort of the primary entity that collects data from states and jurisdictions and helps to put these reports together. And as Shauna said, they're a little bit behind usually just because it takes time to get all of the information and put it together so they can make a report. But for a lot of places that don't have people who are able to put these reports together for their local, county or city. The CDC data that are national are like the most important for them to know what are the trends, who are the populations that are most affected, and that helps them know, as Shauna said, where to kind of target their programming, who are they prioritizing for funding. And so that is important for a lot of different reasons. And, we've been seeing in recent months that some of those systems that are helping to report the data are being dismantled, which is unfortunate because for a lot of places, that's the only way we will get this information. So I hope that that won't happen completely and that there will be another way that we can do that, but it is impactful for a lot of reasons.
And Jalen, I think that this question is especially important for you and your community perspective. And a lot of people can be scared about if their data is collected and what does that mean and who has access to it. And so I guess I'm wondering if you've had conversations about, getting an HIV test and or an STI test, no matter if data is being collected or not, or what your thoughts might be on this.
Yeah, I mean, a lot of my friends do come to me to ask me about like HIV testing and STI testing, but none of them ever brought up concerns about their like information potentially being leaked or something like that. I think that what's to their like, okay, I think what is that like we live in a place where there's a lot of culturally competent providers, and I think that that's what makes people feel more comfortable discussing that information. And luckily, my friends are going to those people who are culturally competent. So I could imagine if like it being something different had that not been the case, but on a one-on-one level, it hasn't really. I haven't heard those stories, or you know.
So I think my main takeaway is cultural competence could solve a lot of issues. But with this, we're kind of move to our next question. So, should public health focus more on HIV in those age 55 and older? I know young people bear a disproportionate burden of HIV and other STIs, but I've heard rates are increasing in older adults.
Yeah, I can start. So, yes, I do agree. There have been, and I think even CDC put out a report talking about how STI rates have gone up in people who are in that age group. And I think it's a good reminder for all of us that, people don't lose necessarily desire or drive or interest in sex just because they reach a certain age. And so, as Jalen was saying about being a culturally competent provider, I think that's important where I try not to make any assumptions about people when I see them. And so I sort of use the same brush that I would for everyone and say, hey, this is what we talk about with everyone. You know, are there things that you feel like could be better about your sex life? When was the last time you were tested? Would you like to be tested? And yeah, I think people would be surprised that we do find STIs. And even recently here, we've had a couple of newer cases of HIV, unfortunately, that we've diagnosed in people who are, 55 or older. So absolutely, I do agree. If people haven't been tested, they certainly should.
Did you want to add, Shauna?
Yeah, I think that was a great answer. I would say that there is some barriers for older adults to get tested. Medicare often will not cover testing too frequently. So making sure you know where some potentially free resources are, or things that are like sliding fee scale, is really important. A lot of health department clinics will offer accessible services for people who are underinsured or uninsured.
Perfect. Thank you both. And so both Shauna and Jalen talked about this a little bit, but could you talk again about what 211 means in regards to PrEP? This is a new topic for a lot of us.
Yes, so basically you take 2 pills, at least 2 hours or 24 hours before sex, and then you take 1 pill 24 hours after sex, and then another pill 24 hours after that. And I think that is I think 86% effective against, or maybe the number is higher, but very effective against HIV infection.
Yeah, and it's really good for people that don't, if you're having regular sex or a lot of sex, it's probably better to be on either an injectable or a daily pill. But, I know some people that are otherwise in monogamous relationships but might go to a regular sex party once a month. That would be like a really good candidate for 211 dosing because they know when they're having sex without protection, and they only need it that time. So it's just another way of doing PrEP if somebody doesn't want to take a daily pill or be on a regular injection.
Great, thank you. We have another person who has said that they don't really like their doctor because their doctor sometimes embarrasses them when they ask questions. And they have friends who are saying the same thing. And, I know we talked about the importance of cultural competence, but when you come across a healthcare provider that doesn't make you comfortable and maybe doesn't have all the greatest cultural competence skills, what are ways in finding a new healthcare provider, especially one who would offer HIV and STI testing?
Well, first, I'm really sorry about that experience, and unfortunately, it is not altogether uncommon. A lot of providers are still really uncomfortable talking about sexual health, which is super unfortunate because sex is normal and sexual health is health, just like diabetes or anything else that we see. Um, if you can find a provider that is specifically marketing themselves as a sexual health provider, oftentimes places that focus on LGBTQ communities also have a lot more training. And you can also, there's a website called Prep Locator. Um, and even if you're not necessarily looking for PrEP, providers at locations that offer PrEP tend to have more education as well in terms of taking sexual health histories and talking about things like that.
I'll say I am not one of our beautiful presenters today, but I had an interesting experience where I had a gynecologist and I was a little unsure of them. They were a little like more naturey than I kind of like when it comes to my healthcare provider. And I didn't feel like they always took my pain seriously, but I thought I was making it up in my head and maybe I was over exaggerating. But I got a new primary care health provider and they took all of my concerns seriously. And like, it was a really great experience. And it just reminded me of sometimes when you have those gut feelings or when you have those questions of, is this the provider for me? Is this the provider who's going to meet my needs? Like sometimes I'm not being crazy. And so I actually just canceled my appointment with the doctor who I wasn't too sure about, and it felt like a really good decision. I think though that I have a lot of privilege and I have health insurance that a lot of healthcare providers accept. And so I definitely felt a little bit more comfortable in making that decision. But I think this can be a really difficult decision to make for a lot of people. And I always encourage you to talk to your friends, talk to your family, learn about your options. All of our presenters today have really talked about some of the free or more affordable options that are available either at a health department or through different websites. So, even when we feel like there aren't options, sometimes we can still find a little bit of hope and a little bit of cultural competence and a little bit of help. So thank you for that, Shauna. We have another question in here where someone said, I would like to know your opinion when is molecular STI point of care testing needed compared to sending those tests to a core lab or a reference lab?
I would say there's a place and a role for both. So, for people who may not know the difference, so um, point of care testing is basically someone takes a sample or you provide a sample and they put it into a machine or a test that is somewhere there next to where you are. So it could be like in a clinic or in a mobile van, somewhere where you're going to get an answer back on if that test is positive or negative. Usually it's within, it can be as short as 10 minutes. Some HIV testing is even less than that, but some tests are not necessarily rapid. It could be like up to an hour and a half. So it's, quick-ish. And so there is a role for that if people want to know their result, as soon as possible, so they can either know if they need to get treatment or, tell their partner like, hey, I'm good, fine for tonight and move on. Sending the test to a lab can often take a little bit longer. So it might be anywhere from like a day to 3 or 4 days before you get results. So there's like benefits and I think pros and cons for each one. It just kind of depends on what the person wants and what the provider thinks is appropriate.
Yeah, point of care testing can also from the clinic level be way more expensive than sending out to a lab. So a lot of places don't offer point of care testing for that reason. I think from a patient's perspective, calling and asking different clinics how long their labs take is totally an appropriate question. Even here in Baltimore, like some of the places will say they take 2 weeks to get results back, whereas my clinic, we take like 2 days. So, um, yeah, but point of care testing is really great when you have access to it.
Thank you both. So we have two last questions in the Q&A box. One of them, they say, hi, I'm in public health. Can you talk about the different ways people can get tested? And I know Chase went over this a lot in their presentation earlier, but I think Chase, if you could just give a very like quick and dirty maybe response to that.
Sure. Yeah, there are a lot of ways that people can get tested. And I think what's good about that is there's often a way that people can find that works best for them. So, like for HIV testing, for some people, it might be appropriate that they can get an over-the-counter oral swab test to be able to test at home. They don't have to go anywhere. They can get their own results and they know their answer pretty quickly. Um, or some people like to go to like a public health clinic, like a STD clinic or a sexual health center. That's an option. Primary care providers are able to order these tests as well. There are community health centers that often can have testing that is free or low cost to people. Um, Actually, a lot of people go to emergency rooms or urgent cares. It's maybe not the most efficient because you might have to wait a while, but they're always there. So that's, the upside is that availability is better if you work late or it's a weekend. So yeah, there's a lot of options. It really just depends on sort of what you want and what works for your life and your budget, I think, too.
Thank you. And, we've talked a lot about the need for people to ask their healthcare provider for different tests or what options the clinic might offer. But, Jalen, from your perspective, we have this amazing community perspective on the panel today. And so I just wonder if you have additional tips for people and thinking about understanding the different testing options and when to reach out or when to ask for certain HIV and STI test, or if that's even a conversation you're having with folks.
I, yeah, sorry. I think Dr. Cannon hit the nail on the head with that. So, yeah, it's not really like one of my friends recently were talking about like, the different methods of like getting the ELISA done and then getting the Western blot and like what that process is. So I think that was a little bit more different because it was like serial conversion, but like, it's like, yeah, I haven't really had that many conversations about, yeah.
Well, we appreciate that. And we now know that there are a lot of different options for HIV and STI testing. And any of us can call a clinic, call a healthcare provider to ask more about those options. I'll also add that this webinar is being recorded. So if you've missed any part of this session, the recording will be available on both the ASHA website and the AVAC website later or soon. And our final question for the day for all of y'all, how can we do a better job of promoting prevention services like PrEP and STI and HIV testing? This attendee feels like there are so many who would benefit, but they aren't aware or know where to go to find services.
I'm just gonna first. I know this is like the $1 million question. I don't think I have. I don't think I have like the answer to this question, but I do think that like what we're doing now, speaking in different panels, talking about things, using social media, I feel like is like when maybe the strongest ways to get the message out there. Maybe like partnering with like TikTok doctor who are real doctors too, but like you maybe have a following on TikTok to like promote this kind of stuff is like one way to really get it to like a broader audience that who aren't sitting in a clinic and like are looking at a pamphlet. You know what I'm saying? So that's one of the things that just came to my head.
Yeah, I agree. I think this is something that we in public health are thinking about a lot. So, not everybody has access to internet or a cell phone. And so trying to think about other ways that we can get the word out using things like posters that are at bus stations or in the libraries or billboards. Of course, all of these things take money, so somebody's got to pay for it, but I think it's definitely worthwhile. And we try to take the approach where we're like kind of hitting it at different angles. So, like Jalen said, social media, print material, all of you who are attending today can kind of talk about it with your friends and people who you know. So word of mouth is also important. So a lot of different ways I think we could do better promoting it.
Yeah, definitely. Also some other things that we've utilized have been like our community advisory boards have been really good advocates within the community, as well as there have been some programs that have focused on educating people in the service industry, like nail salons and barber shops, so that people can have conversations while they're getting those things done. I think that really, as Jalen and Chase have said, um, you know, just talking about it, bringing it up in normal conversations, talking about it whenever you're talking about sex in any way, I think is just really helpful. Um, and and funding is nice, and it's hard. Public health messaging is very hard. If anyone has a better answer for that, you could make a lot of money off of it, I think.
I will say this week at my job, we were coming up with catchy slogans, and one of them was like, don't be scared to make STIs go viral. And I am always the one to talk about chlamydia and syphilis at a dinner table during Thanksgiving, during any important holiday. So I invite all of you to join me in making STIs a little bit more viral and making all of your conversations a little bit more sexy and talking about this with everyone you know, like me. Just make things awkward. But I really appreciate our panelists today, Chase, Shauna, and Jalen. You guys did such a terrific job, and I think we've all learned so much from you. So again, a really big thank you from me, from our ASHA team, and a thank you to everyone who joined us today. And again, this webinar will be recorded, and we will share those links with you as soon as they are available. So I hope everyone has a great rest of their day and they take some type of STI and HIV knowledge into their next conversation. With that, our webinar is over. So goodbye.